Hi, my name is Anna Cespedes. I am doing my medication administration return demo in a virtual environment here for Chamberlain. I am going to begin with a room scan so you can see my environment and ensure I don't have any notes. So I'm going to come around to do that room scan. I don't have any notes anywhere. I don't have any notes. No, nothing. No, nothing. Okay, and I do want to point out that I am using the MAR that was provided. It is not the rubric though. Okay. All right. I think that's a good angle. All right. So I'm going to go ahead and get started. So I'm going to knock on my patient's room. Hi, is it okay if I come in? Perfect. So, hi, my name is Anna. I'm going to be your nurse today. I'm going to be giving you some medication. It should take no more than about 10 minutes. Is now a good time? Perfect. So I'm going to make sure that I give us privacy. I'm going to do hand hygiene. And first things first, I'd like to check your ID band. And I do want to just verify your name and date of birth. Patient has told me their name is Tracy Jones. Their birthday is February 14, 1943, which does match what I have for the medication I'm going to be administering, so on my MAR. So at this time, I do want to just ask if you have any allergies, or any drug allergies, and do you have any specific contraindications to receiving the two medications I have for you, which are insulin, regular insulin, as well as Tylenol, also known as acetaminophen. No contraindications and no allergies. Perfect. So at this time, I just want to explain again the rationale for why you're getting it. You have been running a fever, so the doctor ordered the Tylenol for you, and your blood sugar was a little elevated, so that's why we're giving you the regular insulin. You also would just need to know, again, if there's any adverse effects or reactions to these medications. I would make sure to explain that now to you. Do you have any questions? No? And then do I have your verbal consent to proceed with the medication administration? Yes. All right, perfect. So at this time, I would make sure that I have done any focus assessments to include vital signs. I would want to also ensure that you have the ability to swallow. I then am going to be doing my third label check. The first two occurred in the medication room when I was preparing it. So I am looking at my MAR. I'm going to pretend to have my labels of my medications. And I'm looking again that I have the correct drug, the correct dose, the correct route, the correct time, and the correct patient for both drugs as I compare the label to my medication administration record, also known as a MAR. So again, regular insulin, 5 units, subcutaneous, once daily, perfect. And then acetaminophen, 325 milligram tablet, PO, 1 dose now. Perfect, and these are both for Tracy Jones, so again, I've confirmed my right drug, dose, route, time, and my patient. And again, my documentation is also appropriate too. So at this time, I just want to ask my patient, do you prefer to begin with the injection of the insulin, or would you prefer to start with the acetaminophen? You'd like to start with the injection first. Okay, so then I'm just going to go ahead and do hand hygiene again so I can don clean gloves. I'm going to then help expose your abdomen. Is that an okay location? Yes? Alright, so I'm going to just lower your blanket a little bit to expose that area. Perfect, so then now I'm going to just be assessing that area that I plan to do the injection for any signs of lesions, trauma, bony prominences, or inflammation. I don't see any. So then I'm going to make sure that I can grasp an adequate area of subcutaneous tissue that is at least 1 inch away from your umbilicus. Perfect. I'm going to then grab an antimicrobial swab, an alcohol pad, right? And I'm going to, you're going to feel a little bit of cold. It's going to just wipe, again, in a circular motion, moving outward 2 inches. Okay, and then I'm going to allow that to air dry. Okay, and at this time, I'm going to grab what I'm going to say is my insulin syringe and needle that is prepared with the 5 units of insulin. It is just a pen, okay? So at this time, it has dried. Okay, so I am going to uncap my needle. I am going to I'm going to be grasping your skin again with my non-dominant hand. Okay, you're going, and the angle I'm going to be going in is 45 degrees. So I'm going to let my patient know you're going to feel a stick. So I'm going to go in quickly at 45 degrees. I'm going to release my non-dominant hand, and I'm going to use that then to stabilize my needle. I'm going to use my dominant hand to slowly inject the medication on that plunger. Then I'm going to release my non-dominant hand, bring out my needle at the same angle I went in, put the little piece of gauze I have here, place that on the patient's injection site. I would then activate my safety and throw this into the sharps container. So this is in the sharps. Okay, and now I just want to assess the area for any redness, bleeding, or reaction. Perfect, so then I can offer again an adhesive bandage to place on top of that injection site, and then I would just cover my patient up. Okay, at this time I am going to again discard of any materials that I already had, so maybe my pen cap, that kind of stuff. I'm going to then take off my gloves, do hand hygiene. We're going to proceed with the Tylenol or the acetaminophen at this time, so I want to make sure that your head of the bed is up at least a minimum of 30 degrees. I'm going to ensure you have a cup of water with a straw. I'm going to pop that medication into its medication cup, and then I'm going to provide it to you. I'm going to ensure that you swallow it. Patient has swallowed it. Perfect. So now I'm going to take any garbage that I have, toss that out in the trash bin. I'm going to do hand hygiene one more time. And then at this point, I just want to make sure that you're comfortable, you don't have any other needs. No. So then I'm going to lower your bed to the lowest position. I'm going to make sure it's locked. I'm going to bring up the side rail if applicable. I'm going to make sure you have your call light. And I hope you have a wonderful day. And I'm going to do hand hygiene on the way out. Thank you.